Okay, so now we are going to start. The next one topic is there, that is a herbal drug interaction is there. So this one is nothing but what herbs. What is herb? That is the material which is to be obtained from the nature, that we call it as a herb. Drug means what? Why we are going to take the drug? That when you suffer by any disease condition, then and then we are going to take the drug. Means when the our body is there is not to be function properly, we want to function that body normally. In that case, we are going to use drug, and that drug is obtained from the natural source, such as the plant materials are there. So we call it as a herb. So that is a herb which is to be obtained from the natural source. Drug to recover from that one ill condition to the normal condition, that we call it as a drug. Okay. And interaction means what? When we are going to take a drug, we don't want any type of the side effects, toxic effect, but that side effect or the toxic effect that is will happen, that we call it as a interaction. Means we don't want some effects, we don't want some of the adverse effect, toxic effect, that type of the effect, though they are to be appear in our body, we call it as a interaction. Hope all of you understand this one. Okay. So this is the herbal drug interaction. Herb means what? That is the material which is obtained from the plant sources or the natural sources, are the plant source, animal source, or the mineral source are there. Okay. And when that material we are going to use, when we are going to use that one material when our body is not functioning properly, so in this case we are going to use this one drug. But when you are going to take this one drug, some of the effects that we don't want, but these effects are there, that it should be appear in our body, or our body shows such type of the effects, that type of the effects are there, that is known as a interactions. Hope all of you understand all this one. Yes, Kasarati, you understand? Kasarati, okay. So we discussed regarding this one. What are the herb drug interactions are there? Okay. Means what type of the herbal drug interactions are there that it will occur? How the herb interact with the co-administered drug, means if some of the drugs are there that is to be taken along with some other drug material, such as the nutraceutical, food, or the disease conditions are there that are to be taken or observed, whether there is a interaction is that should happen or not, such type of defects, whether they are to be diagnosed, means sometime the you have to be say that the drug interactions if there should happen, but sometimes we don't understand whether there is this is the drug interaction or some of the side effects are there. Suppose you are going to take a paracetamol tablet, and if that paracetamol tablet is showing some of the allergic reaction on your body, that is the interaction. But when you go to the physician, and physician what they physician is not going to say that this is the interaction. Physician is going to recover or use the treatment by which you can get the recover from that one allergic reaction. So whether some type of the interactions are there that is not to be diagnosed, some type of the interactions are there that is to be diagnosed. Are they neglected? Means every interaction is not, we have not to be concentrate more on this one interaction, but some of the interactions are there that should be appear frequently, on that we have to take a concentration, or we have to give a concentration why this type of the interactions are there that should happen. Some type of the peoples are there that is having the allergy of the clothes, some are having the allergy of the food, some are having the allergy of the soap, or some of them are having the allergy of the air or the dust is there. So such type of the interactions are there might be neglected. We are going to take care regarding this one. They are not to be serious one, but some of the interactions are there that are serious one. They may induce some of the toxic effect on our body. So we have to concentrate on this type of the interactions. What is the significance of the body? Means whether there is any toxic effects are there that should be available or not, whether any reports there should be available, means what type of the interactions are there that should be appear, whether this one So whether these interactions are there, that should be happens. Just we are going to be think that whether your parents are there or the grandparents are there, that you should suffer by such type of the disease condition or not. Suppose you are suffer by the some allergic reaction. When you go to the physician asks you whether any one member in your family are having the same type of the problem or not. Or suppose that in your one disease is there, then in this case physician is asked whether you are to be suffer by the same or any one member should be suffer by this one disease or not. Likewise, the reports are there that you should make available. The significant study, if the reports are there, then we have to concentrate on this one. And the significant studies are there that should be carried out. And this is the need for the study. If there some of the allergic reactions are there, there is a need to study such type of the interactions are there. So this is the reasons are there by which we are going to study the herbal drug interactions. So hope all of you are going to understand these things. Yes, are you understanding this one? Yes, More Sanket, please unmute yourself. Loda Harshal, sorry, Londe Harshal, are you understand this one? Both say yes, all of you understand. Yes, thank you for your message. Okay. So the next one point is there, that is the herb drug plus allopathic drug, and some of the interactions are there that should happen. So when these one interactions are there that should happen on our body, so they are means when you we came to know that some of the interactions are there that should happen. Suppose they are going to take the paracetamol, and the drug is there, it's work properly and he is not going to show any adverse effect or the side effect or the toxic effect, then we can say that there is no interactions are there. But if there is some of the nausea, vomiting, headache is there that should happen, we can say that the drug is interacted, and the drug interaction is there should happen, means the drug is affecting on the kinetic property as well as the dynamic property. This kinetic property and the dynamic property are changes. What is the normal body functions are there, that change in your body functions are there that will appear because of the drug, that we call it as a interaction. Okay. So herbs often administered in the combination with the therapeutic drugs, raising the potential of the herb-drug interaction. Means we always say that the herbs are there that are safe. They are not going to show the any effects or the side effects are there when they are to be taken in a therapeutic dose. So such type of the interactions are there that is not to be happen. But if any one synthetic drug that you have to be taken, and along with that, if you are going to take the any one drug or herbal material, though, so that the synthetic drug and your herbal drug, they are to be interact with each other, and they may show the synergistic effect, means additive effect. 1 plus 1 is not equal to 2, but it's equal to the 3. So such type of the effects are there that should appear. So that is known as a herbal drug interaction. Somewhere they nullify the effect of each other. For example, you are going to take the some of the diazepam for the sleeping, for the sleep, you are not getting a natural sleep, so you are going to take the diazepam like drug for inducing the sleep. But at the same time, if you are going to take the tea or the coffee, they produces the CNS stimulant effect. So because of which the diazepam which you have to be taken, the effect of the diazepam is not to be appear if you are going to take this one coffee or the tea is there. Okay. So same type of the effects are there that should appear. Herbs or the herbal drug often take with the allopathic drug, we believe that it will have some beneficial effect. Most of the herbal drugs are taken because of the availability of the economic consideration and safety, easily available, just like your ginger is there for the cough. We are going to use turmeric, we are going to use aloe vera, we are going to use your ginger, we are to